just of everyone's time. So we'll go ahead and get started today. And as people trickle in, we can have them write their names in the chat if needed. So hi, everyone. My name is Shri Patel, and I'm from India Home. Today, my colleagues and I will be conducting a webinar addressing language barriers that lead to health misconceptions, in particular, misconceptions related to COVID-19 and vaccinations. I'd like to take a few moments to encourage everyone to write their name and organization in the chat, and if you are able to, please turn on your camera. So for our agenda today, we will be discussing some challenges that our team has faced in particular to this concept of health misconceptions and how language barriers play a role into that. Further, we will discuss how we face adversity. And then lastly, we will discuss some strategies and key takeaways that our CHWs and team has used in order to address this. So I will turn it over to my colleagues to introduce themselves before reintroducing myself as well.
Hi everyone, my name is Dilla Froze. I am the outreach supervisor here at India Home. I've been here, I think, almost 3 years now. I will be monitoring the chat as well as co-presenting.
Good afternoon, everyone. My name is Victoria. I'm a community health worker with India Home. I've been here for a bit over a year now. I think I'd make 2 years in July. I work on a lot of the vaccine initiatives, and I'm currently in school for public health.
So hi everyone, to reintroduce myself, I'm Shri Patel. I'm a data analyst for India Home. I've been at India Home for about a year and a half, and I'm also currently in graduate school to get a master's in public health.
Hi, good afternoon. This is Shaila. I'm working India Home is almost like 4 years, and I am a program assistant, and I've been working directly with the community members and the Deshi Senior Centers, where I being a part of like a translator in education session. Also, I help India Home for translating for program flyers and materials. So this is my introduce, and I hope we will going to have a nice session today. Thank you.
Thank you, Shyla. So I just wanted to speak a little bit about India Home's experience and what makes us qualified to speak on addressing these language barriers. First is India Home is a trusted community-based organization. Our organization has been present in the same area for years, since 2007, and we have established trust within the community. Further, our organization specializes in South Asian community. A lot of our staff is South Asian based, so they do have this cultural competency that other organizations may not have in this priority group. And our organization really does take an effort to address the disparities in the South Asian community, but we also encourage addressing other priority populations within the community as well. Further, our CHWs have years of translation experience. Our CHWs have been translating flyers and materials pre-COVID as well as post-COVID. And further, our CHWs, many of them are bilingual or multilingual, so they do have different backgrounds and cultural experiences that do help in discussing health misconceptions as well as health education to community members. So I'm going to pass the mic over to Victoria to continue with a good amount of the challenges, our experiences, and things like that.
Thank you, Shri. So first, I'm going to talk about the challenges and definitely how we overcome some of these challenges in terms of resolving language barriers and, like I said, how we address them. So the challenges that we tend to run into are myths, having community members with limited health literacy, establishing trust, and how translated messages can get misinterpreted, aka lost in translation. As far as myths or misconceptions we have heard, I would say that these are the top three that we've had, that you can get COVID from the COVID vaccine, that COVID-19 vaccines cause neurodivergent symptoms, and that it does affect fertility as well as infants in the womb. So I want to ask anyone in the audience, how would you address the claims that are presented on this slide? Well, I can go ahead and answer my own question. Right here, this picture, this graphic right here is from the India Home Facebook page. You see the myth, getting COVID-19 vaccine will give me COVID. But they put the fact, COVID-19 vaccines do not contain the live virus and they cannot give you COVID. So that's an example of how we would combat these claims. And continuing to address myths, one of the things that comes up the most is that mask wearing updates are constantly changing. So there is a myth around the effectiveness of mask wearing. What we've heard a lot actually is people reusing their surgical mask, which is a one-time mask, and people are considering that a safe practice. And it's definitely not. So a visual is a good way to dispel the myth and show actual mask guidance. Pictures can be more engaging than numbers. Garnering trust is something that we definitely have to do in order to get over language barriers. I want to, before I step into what's on the side, I want to ask the audience, how can we garner trust when there is constant change in COVID-19 guidelines? Does anyone have any ideas? A quick strategy that they like to use? I know it can be difficult. A lot of people tend to just give up on the whole trust aspect because they're like, how can we gain the trust? There's no point. But for India Home, we've established a feedback loop in a WhatsApp group, as a matter of fact, that we have with our older adults that attend our centers. Having someone that speaks the language and knows the culture is also a great way. So some of the examples that you guys could have given would have been keeping open lines of communication, aka feedback loop. We also use our social media platform for that. And for the challenge for limited health literacy. So health literacy is something that I think a lot of people lacked in terms with this pandemic. That's my personal opinion. And this is something that India Home has seen. It's common among English and non-English speakers. So, in terms of health literacy, it's when the technical language used in credible resources are used without context. For example, telling people to get an mRNA vaccine. A lot of people may not know what mRNA means. It sounds scary. It's like, well, why do I need an mRNA vaccine? And that makes it hard to explain why vaccines are safe. There's also a lack of data clarification as a challenge. People can't understand the impact of the pandemic just by listing statistics, and the uncertainty of the changing science, like we saw with mask wearing. It's also the same thing with COVID variants. And like I mentioned before, all of this makes it difficult for community members to understand the impact of COVID-19 on health. So the limited health literacy is a challenge. But addressing this, you want to make the science and the statistics more accessible. So I have a graphic here, and I want to ask the audience, what is accessible about this particular statistic? The statistic is the risk of dying from COVID-19. That's what we are providing here. So does anyone in the audience want to tell me what is accessible about this particular statistic, or any feedback on what could make it more accessible? This is a graphic from India Home, and we will go over making graphics later in this presentation. I know for me, when I saw this graphic on the Facebook page, one thing that made it helpful is that the visual data, there's context given here. It's in terms of the difference between unvaccinated versus vaccinated older adults. So in that context, the statistic is in bold, 12 times more at risk, 2 times more at risk. So it's able to give a statistic as well as emphasize the context of what the statistic means. You can't just list a statistic. You have to give it context. You have to bold it, make it more presentable for people to understand. So that would be my answer to my question. But yes.
Something I would like to add is maybe a potential room for improvement would be the use of brighter colors, just to highlight some of the important information like risk of dying from COVID-19. Maybe a brighter green could help those who are visually impaired.
Yeah, that's actually a part of language barriers that I think a lot of people don't necessarily talk about. It's not about just being able to talk or listen, also visually, yeah. People with visual impairments, you want them to be able to see as well. So thank you, Sri, for that. That is making it more accessible. Yeah, definitely. Yeah. And then I'm going to ask you guys about this other graphic regarding health literacy. What about this graphic regarding COVID-19 may be helpful to understand? If you're trying to convince people to get a bivalent booster, for example, what potentially stands out about the graphic?
I like the color coding.
That's what I was looking for as an answer. Yeah, the color coding. Kind of like what Shri said in the last slide was a good example for that. For this slide, more graphics, less words. Instead of listing percentages of COVID infections and transmission rates and like COVID cases are this percent. Instead of doing that, show pictures in bold colors. Show that New York is red. Like, hey man, look, Queens, it's part of New York, it's red. That means transmission is high. So yeah, we use like colors and stuff like that to convey the case rate in New York City. And as you can see, we also translated it. And simple statement, less words, more colors. Does anyone have any feedback on this one potentially? Because definitely want to make this collaborative. Oh, I think Michael said something in the chat.
Yeah, he asked where a good source would be to share where to gather the
Graphics.
images from.
Yeah. He wants to share this.
Oh, okay. So a good source to share where to gather images. So the image from this is actually from the CDC. So what we like to do is just do our research and go through the websites and see what potentially comes up. And usually for the websites, I can say they'll have like a chart next to it that kind of explains the color coding, but still with numbers. So we kind of crop the pictures, but still give credit to the original source. The original sources will usually have a lot more words around it, like even more words than this. So we crop it to show the whole point. Like, for example, I think this map was of the United States as a whole. And then as you can see, New York as a whole. So you can use credible sources to gather the images, but it's a matter of how you edit them and make them more accessible is what I'm trying to get at. So the original image didn't look like this. I have cropped it to highlight New York, to show the source and just to get the point across that transmission is high. And you can see that with the color coding down here. And then the words is just explaining what's going on in the picture in simple language and then translating it. I hope that was helpful, Michael. Let me know if that wasn't a clear explanation. All right, thank you. Okay.
Sorry about that. I will reshare in just a moment. My computer froze.
It's okay. Everyone could take a moment to digest, health literacy and all.
You know, I think it's also the CDC website where you can look at zip code specific ones too, right? Was that like
Yes.
where there's like a toggle and it tells you all
Yes.
the places, right?
Yep.
That was
Yep.
good for like having local outreaches and stuff where you find out like your like let's say your
Your
neighborhood
area.
opposed to like a couple neighborhoods down. Like
Yeah.
why is this higher?
Exactly. It's important. So as community health workers, off the field is doing the research. So that's how I end up going through these websites and playing around with it and seeing where the data is coming from. So definitely Department of Health websites and of course the CDC, you can get it, but you want to make sure you can interpret the image as well in a way for people to understand. And of course, slap a translation on it. And finally, I would say definitely one of the most challenging things about this pandemic and getting information out are things being lost in translation. So this happens for both non-English languages and English languages. Starting for the challenge for English material, I would say that credible sources have complex language and jargon, and people with a limited English proficiency would have a hard time, reading or trying to understand what is being said. A lot of credible resources right now do assume a level of health literacy. Michael, for example, your question, I was actually making a presentation for an education session we're having next week, and I was having to go through the data for wastewater, for COVID particles in wastewater. And I went through the New York State of Health and I had to go through their data report, and they had the pictures, but the pictures had other information in it and complex language. So, like I did in the last example, for this as well, I had to change the language to make sure the health literacy is on a basic level. Make sure that the English used is more common versus overly formal. You want to tailor the materials to use most commonly used language. And loss in translation for languages other than English. There are challenges for translated credible resources. Like English resources, they do assume a level of health literacy in communities that don't speak English as well. And the materials that are available are often written in a language that is uncommon. By that, I mean the language does not capture cultural nuances. For example, in Bangla, the Bangla that is commonly used is different from the antiquated versions of Bangla that are on credible resources. I think Michael has a question.
I think that's Nicole.
Yeah, hi. I don't know why it's showing, that's so weird. It's showing my name is Michael, but yeah, no, it's okay. I was wondering when we think about the translation piece of it, I know cell phones have some translation apps that a lot of non-English speaking people use, particularly people when they're not close to family members that help with the translation piece of it. I'm wondering if there's a way to also think about how we include instructions on how to get people to think about their technology pieces. And so when they walk around and they can just turn their phone on and just kind of like use that app. Is that something that you guys focus on to help, during events and things like that?
I think we noticed that a lot of the translations that are provided, like let's say not just Google Translate, but sometimes it's even those third party services. I remember when we were at those vaccine sites, when there was a mayor's call to action and there was like the Vax for All project going on, we had um, an on-call like third party. So if we needed ASL, we needed any language, they were there. You called them or FaceTime them. Well, it wasn't FaceTime, it was like a video conference. And the problem was sometimes things always got lost in translation. I'm not sure if it was because there's a person involved or what, but sometimes even like just getting a quick little Google going on, like the synonyms for certain words just were very thrown off. So
Yeah.
yeah, it's just like we try to work around it by having our staff present, or if we don't have a staff that can speak the language, we try to partner with other organizations that have that capacity. Or um, we'll give them an informational flyer that might be in the language that they need, and then give them the English version as well. Because what happens is sometimes I remember growing up, my mom, she didn't speak English. So what happened was we were provided a translated flyer, but it was written in a type of Bangla that we don't use day to day, or it was kind of like let's say it's Shakespeare's writing, like for us, like English to different English. So it's harder to understand. So she started telling me to stop bringing those flyers home, just bring the English one. I'd rather have my 5-year-old translate that to me than have that
Yeah,
big version.
that makes sense. Awesome. Thank you.
Thank you, Dill. Yeah, it's definitely something difficult. Even with technology today, I think there's still language gaps with that. I've tried to use Google Translate on the field as well, and it doesn't always match up the dialect, which is why India Home also likes to give out like paper material as well, so you can kind of cross-reference. The paper material with those translations have it shorter, more cultural nuances included because we translate it. And then if I'm on the field, I have that at least with the Google Translate. So kind of like a partnership. Shyla has her hand raised. Go for it.
Yes, I'm just giving some example. Like Michelle, she talk about like some online apps regarding the translation apps. So last night I found one. It's a, like promoting apps for the people for installation. So I'm just, if you guys see this picture, you can see. You see?
We actually cannot, but maybe you could
Okay,
describe it,
okay.
Shyla.
It's just like they promoting like New York is now starting free language course. It's fine. Bangla translation. Here is a Bangla translation from English to Bangla. But the last line, it actually should mention like what until what date it gonna be going on. The like the registration, enrollment, and the course line. But they here translated Bangla, it's too much complicated. People don't understand. I am, my first language is Bangla. My native is Bangla. I'm very fluent in Bangla. Not even I understand what actually the word is here. So how the general people can understand? Like one Bangla word, I think Dil can some understand, like upolabdho. Upolabdho English means recognize, or like there is another synonyms like feel. But it should be like it's opening, like it's remaining there until that day. So whole sentence meaning very complex. So these are the actually challenges for the people and the audiences. Those are follow this line. So I understand what actually they are mean, but some other like who have different background, it's very difficult to understand. So promotion thing should be the tone of the voice of the audiences, what actually we want to reach them. Thank you.
Thank you, Shyla. Yes, that's a great example. And I can't wait for you to expand on this further. Yeah, definitely even the apps can be very complex. So it's definitely important to know, you have to know your audience, unfortunately, and be able to communicate with them. And we have found that some apps that well, not necessarily apps, like Google Translate, for example, is not a good way to meet our audience. But definitely, like Jill said in the chat, we're definitely interested in looking at other apps as well that might have more effective translation services. But yes, thank you all for that feedback. And we kind of just talked about this as far as addressing all those challenges, having the in-house translations. And then also I think this could go back to Nicole, what you had said about the apps. Well, maybe sharing the information with other organizations is a good way to go. It's like we share information with another CBO or with the Department of Health that's relying on a lot of technology. So sharing these materials is important. Having the staff out on the field that can speak the multiple English languages, and ensuring that CBOs have resources for language appropriate follow-ups. So I'm going to go over some infographic best practices. I know I did give some of those examples from the India Home Facebook page, from the other health website that talked about the mask wearing. We've seen some of those graphics. So I want to definitely go over some of those best practices, making sure it has a call to action, making sure it has compelling images, limited text, and clear translation. You want to make sure that the branding you use has recognizable and trusted logos that community members recognize. So we definitely like to use our India Home logo a lot so people know who we are. Very little words, and contact info is clearly laid out, and using graphics and short buzzwords for words that both limited English speakers and those who speak the languages where translated material is limited to see. So here's the infographic that we have. I want to ask people in the audience, what are some of the elements on this flyer that fit some of those best practices that I just mentioned?
I
Uh,
think
oh,
oh,
go ahead. Yay, go for it.
the CVS and the Walgreens logo are two of the ones that definitely stand out just because of the fact that that's the most recognizable as people are walking down the street, driving in their cars, anything like that. And it's something that they can easily recall to their daily lives and know that that is definitely a place that they can go, as well as the little vaccine vial. And I'm blanking on the name of the tool that you use to give vaccines, but those also are very helpful for people to know that they associate those normally together, as well as those help them realize that they can also probably have this done at most of their other health sources that they might have.
Yeah, thank you, Michael. Yeah, you pretty much just answered the question of like the logos and the branding, compelling images to attract people and make it feel a bit more trustworthy. Yeah, you're right. Seeing CVS and Walgreens all the time, you're like, oh, I know where that is. That's a pharmacy. Yeah. All right. Anybody else? I will give one, and then Shree's actually gonna show. So a call to action, short and sweet to the point. Schedule your vaccine for COVID-19 and flu. Not here are some reasons why you should, and these is where you can go. Short and sweet and to the point. We did just talk about the compelling images, and I want to go over some of the other compelling images and icons that we have. Also, are the flu fighter, and I got my vaccine, COVID vaccine, because I know that's a milestone for a lot of people. You're showing that you're protecting your health or ways you can protect your health. And the action is repeated. Clear contact info on here, as well as an action they can actually do. They can scan it. So they can call us or they can scan the QR code. So call to action, compelling images, and action repeated are infographic practices that were used on this flyer. Here's another example of another flyer that we used with our Desi seniors. As you can see, it's translated to Bangla. The translated versions can look similar, which saves us time in terms of translating. And using buzzwords / limited text can help when translation resources are limited. So we kept it short and sweet just because it's easier for our seniors who speak this language to get a message short and sweet. Just get your flu shot. Not having a lot of text heavy and more images, and then translating that makes it more accessible for our older adults, which is who this flyer was for, actually. And of course, finally, our translation processes, which we do use in our infographics. I have another example here. Um, like we talked about before, like Shyla mentioned, you got to match your target audience. So for this graphic that I have here, this is a graphic I would use for people that go to food pantries, who right on the spot have a difficulty understanding how the vaccine works. Instead of handing out a credible resource flyer that has an intricate detailed graphic, I kind of summarize the graphic here. This visual aid is actually from an education session PowerPoint slide that we used at one of our older adult centers. And like I said, I've handed out flyers like this to people at food pantries. It has simpler terminology on it, and the visual aids. So this is to show how the vaccine works. It instructs, produces antibodies, and then defends against the virus. Does anyone have any feedback on potentially a graphic like this? This is kind of like I said, I would use to explain how the virus works, just making it more accessible in general. If there's no feedback, I'll take that as a good thing. All right, perfect. And this is our segue onto Shyla. In other languages, you can still make it more accessible, like we mentioned, having a professional that is fluent in both the source and the target language, making the material culturally and linguistically appropriate, and amending already translated material. And we do this to improve the accuracy and the clarity in the translations. So without further ado, I will hand it over to Shyla, our very own program assistant who works up close with our seniors, and other people in the community. She can give you firsthand experience on overcoming language barriers. Thank you.
Hi, Shyla. I think you need to unmute.
Sorry, guys. Thank you, Victoria, for your nice information. It's a very informative and very clear for understand. Thank you. And now I'm actually going to firsthand experience when I started to outreach work and community work and like Deshi Senior Center, and also help India Home as a translator to translate like program flyers and so on. So regarding the translating material in Bangla, basically I am doing since my joining, like because our Deshi Senior Center has different activities, some departmental expertise, special experienced and expertise people are used to come here to provide different kind of session for the benefits of our seniors. So those session actually I'm act role as a Bangla translator. So I feel so good for our seniors that they're gonna be like a very good understanding what actually the information they are sharing. So this role always I'm doing now, and also I do like a co-facilitator in Zooming and the webinar also, and the program flyers also. Those just earlier Victoria showed that English to Bangla translations that I always do and help India Home. And sometimes, you know, that Google translation are always not effective when it comes to a translations. That's point that first of all, I want to say like translation always need accuracy, a particular tone of voice that will appeal authentically like to a specific target audience. And we aware that the people who are migrated here or who lives here, they have different background, especially in South Asian communities. They need more native language, which makes them feel heard, which makes them like, okay, there are somebody here that I can understand. It's a different language, but my culture, as they seen me and they willing to ask their requirements. And also another point is like Google Translate always follows directly to use without any understanding and conceptions, and the terminology creates inaccuracy, misconception of the meaning and understand properly. And finally, I can say for the Google translation is the root cause is lack of efficient translator, because those who ever translate anything, at least he or she has like a background, the issue he is going to translate, or for example, law background, human rights background, financial background. So if somebody are relevant with this field or similar field, if they translate, they can understand what the native language will be addressed properly to the audiences, because one word have different synonyms in the world. So I, as being a translator, I should think about my audiences and their label and their background. Then I put it in a translator that easy understand, because we have a specific goal to reach our people. So we need to focusing on them. And next point, like how India Home translating have been like exemplary, because you know that we have a vast expert language translator in like a translator employees in India Home. So we can, all of us, we do like diversity of the languages to one language to another language. That entails like the accurate meaning of the tone, and one language to another language, it covers original tone, intent of masses, which reflected into a cultural confident and the religion differences. And how outreach and education session have built trust among the people who we work with. So, you know, when we have a very expert outreach team, those have a diversity of language efficiency. So within a team member, when we go in the outreach, so we help our people in a different diversity languages. Because like being a Bangladeshi, when I work to my community people, I feel very confident because Bangla is my first language and I'm very fluent in my native language. And when the Bangladeshi community people sometimes feel shaky, they are not comfortable to ask question, to reach us, what we are trying to educate them, then I feel like I'm blessed and I'm privileged to help my community to understand what actually we want to reach them. Because at the end of the day, or at the end of the project, we have a specific goal, we have a specific output. If we are not reach them to make them more educated, more understandable, it's not gonna be work. So we are the team in India Home. We are trying to like an integrated process and help all the community members in different diversity level, different languages, that our expert team is very, very much supportive and willing to help our community. So this is actually, and I'm just lastly, I want to two things to add, like when I'm moving in a, like here the picture I can explain. One of our Bangladeshi, she's a Bangladeshi woman, she can read Bangla, but I am assisting her to understand what the meaning, because there is a sub-medical terminology here, assistance terminology here. So all the people don't have that word, that like sentence. So then one line to another line, I explain to her what does it mean. So we are very close to our audience, our community people, to help them to understand properly. And when I ever see in the like public transport, in the subway, like in a different kind of places, they are providing promotional materials. Being a Bangladeshi first language, I am being feel very sad and very upset. What does it mean? Then I am also trying, because I'm very fluent in Bangla, but the translation things is extremely very, very complicated. So whoever we work and other organizations, city and everybody reaching out in different promotional materials, translating in different languages, everybody should focus in our audience and actual tone that authentically appeal to our audiences. Thank you, everyone. And do you have any question or any feedback? So you can add with me. And I am handing over to Dil for Test and Trace project to talk about this. Thank you.
Thank you, Shyla, for speaking on your experience with the community. And thank you so much for like what you do for the community. I feel like we don't thank you enough, because I'm over here seeing how my mom struggled with understanding these flyers. And you're saying with your background and your education from all this, you're still struggling to understand as well. So I'm so glad that like we're kind of fixing it up, we're cleaning it up for the community. Okay, so I'm just going to talk a little bit about the Test and Trace project. It was a partnership with the New York City Health and Hospitals between the CBOs and as well as the Department of Health and Mental Hygiene. Throughout the project, we addressed the linguistic, cultural, and religious diversity of the South Asian community in Queens, New York City, by establishing a diverse team of community ambassadors. Our team has a fluent range of languages. It's Bangla, Punjabi, Hindi, Urdu, Tibetan, Nepali, and I think we have more now. We have Spanish, we have I think Gujarati now as well. So this linguistic diversity ensures that we can communicate directly and effectively with the members of the communities. The ambassadors provided on-the-spot translations of materials, provided clarifications, and had in-language conversations on the field, like you saw in the picture in the last slide as well. All right.
Thank you so much, Dil. Yeah, for pretty much sharing how India Home started with overcoming these COVID-19 language barriers. This was definitely the start. So thank you for that. And basically, just to wrap it up and go over some key takeaways. The key takeaways are to show and just go over what can be done to create accessible language tools. Ones that can be used to address misconceptions, address mistrust, and address vaccine uptake. So a key takeaway is utilizing visuals to convey messaging. It can make complex information just more understandable, more memorable through all the examples that we showed. And then with having those, you want to embrace diverse language communication. And you can do this through having diverse staff. That is essential. So on a CDO level, on a Department of Health level, on a community level. you want to have that diverse language communication. By having a team proficient in various languages, we can effectively engage with individuals from diverse linguistic backgrounds. We can foster that trust and foster that understanding. And finally, providing translations of vaccine information. Accessible materials do ensure that everyone, regardless of their language proficiency or health literacy, can access accurate and reliable information. I will leave it open for any questions. I know we had one earlier from we had one both from Michael and from Nicole. So that was great. Thank you guys for the questions. Do you guys have any other questions or feedback?
No,
And we
this was this was really good. Thank you so much. It really does help me see how you're thinking about this work. To hear you guys present it, I know, we've been going through the slides, and so we've been kind of looking at it piece by piece, but to see it in its actual flow is very, very helpful. So thank you. I really appreciate you sharing this with us.
Thank you, thank you. Yeah, it's just fun stuff to talk about. You have to acknowledge it, especially in the times that we're in. I feel like the pandemic highlighted a lot of ways society was failing our community members in more modern day terms for more people to see. This country's always had its issues, but we're all here, we're a melting pot. Everyone deserves the same health equity, and this is one of the ways to do it. I think a lot of things could have been, done differently in the pandemic, and these are
Mhm.
some of the ways that we could have done differently. And now we know for future initiatives, just because, infectious diseases and chronic diseases don't go anywhere. It's going to be something that's continuing. And the best way to treat human nature is sustain communication and overcome these different barriers.
Yeah, for sure. And I think continuing to talk about it, but also continuing to point out where the pain points are so that you kind of can avoid it for the next time around would be super helpful. I think one of the things I would consolidate just seeing this now is like maybe a rehash at the end of like, now that we have all this information, we've seen the challenges, we see where the pandemic is really most persistent. Like I would have maybe a slide at the end that says, just to recap, here are the biggest key takeaways that we want, how we want to work together. There could be one bullet for that. How we can avoid pitfalls in the future. There could be a bullet for that. How we're showing up and doing things well. So you kind of keep that balance of like positive, not negative, but challenges / positive / here are our key things. I think that will help people remember when this is all over, like those big, big takeaways.
Definitely, definitely. Thank you for that feedback. I'm actually, taking note on that.
Yeah,
Yeah,
for
of
sure.
course. So this is something we have to keep talking about, like you said. So more feedback, the better.
Yeah,
Thank
because
you.
I mean, like you said, it's not a one and done. We don't know when the
Right.
next, unfortunately, pandemic is going to be. So it's better to be prepared and not like living with rose tinted, glasses on, like, okay, we got through that. We're finally, we're free.
Right.
I mean, it's still, and it's still impacting so many communities. Like a lot of people have recovered, but there's just a lot of communities and families that have not, and so really kind of acknowledging that, I think, is a big piece of it as well. This is not an old conversation. This is very much still, relevant.
Right. Yeah, definitely. Thank you.
Yeah. And Dill, I did look up a couple apps. I was kind of like trying to like do some quick research because I wanted to share it for the group. I found one, but they don't have Bangla interpretation. They don't have Bangla translation. That's the only
Oh
drawback. I know. I
I'm
know.
here.
Uh,
no. She's volunteering.
I'm here.
okay, good. Because the apps have not caught up, apparently. So I don't want to share anything that's just not going to be helpful for your communities.
I
That you're
just hope that the ones that they do have out there, that it's just done properly. So that way, even though it's out, there isn't more miscommunication out there.
yeah, exactly. Yeah, because there could be a lot lost in translation and miscommunicated.
Yeah.
Makes your job harder.
Yeah. Because then we have to clean up the misconceptions they have from the translations that aren't accurate.
Mm-hmm. Yep.
But I like to say, like, now is brushing up. I see, like, it's not like when I first came in this country, I see that kind of translation, but it's improving. That's a good thing because we are addressing, we are struggling to improve this. But now the positive changes is coming because recently, because always I have an intention to look on. I don't know why. Is this an improvement happen? So very recently, I see some promotional material that are flyers. They are promoting a different level at different events. So it's better. Previous now, I hope in future it will goes well because so for my knowledge, I heard like of other network like there are so many Bangladeshi education, good education level, good background in Bangla. They are joining in different program. And actually as a professionally and efficiency, they are doing these things. That's a very like positive changes is coming right now.
That's great to hear. Does anyone have any more questions? Nope. So I just want to thank everyone for joining us here today. We appreciate your time and participation in our second webinar. We will send out a follow-up email with a copy of the slides as well as an infographic with some of our best practices labeled on there. I've attached your emails on the slide, so please feel free to email us with any questions or concerns. And we will be conducting another webinar February 8th on mitigating stigma and hesitancy related to COVID-19 vaccines. If you wish to join us, the registration link will be included in the follow-up email. Thank you again and have a great day.
Thank
Thank
you.
you.
Fantastic. Thank you so much.